Hello everyone, I'm Faizel Osman. I'm a cardiologist and electrophysiologist working in Coventry in the United Kingdom.
Hi, good morning. My name is Alta Schutte. I am a professor of cardiovascular medicine at the University of New South Wales and the George Institute for Global Health in Sydney, Australia, working mostly in blood pressure monitoring and hypertension management.
So Alta, if we can start off with a case study of a patient that I came across very recently. A 50-year-old nurse, a very busy job, she was working in ITU, was getting some fluttering and palpitation but just ignored it, short lasting episodes, and was driving home after an on-call. And she was going to a traffic light and all of a sudden lost feeling in her left arm, her left leg became weak and her vision disappeared. Sadly, she crashed her car into a lamppost, but she was okay. She was rushed to her own hospital and she had had a stroke, which affected her left side. And interestingly, she was also in atrial fibrillation. And that was the first time it's been picked up. And she underwent some treatment, some interventional treatment, thrombectomy, made a reasonably good recovery, slight weakness in her left arm, and some slurring only when she was under stress. But again, the case seems to highlight the importance of detection of atrial fibrillation. What are your thoughts on that?
Yes, I think that is one of our main challenges. It's both these two important risk factors for outcomes such as stroke, high blood pressure and atrial fibrillation. They are becoming so common and large proportions of the population walking around with it, but really not even being aware, especially also AF can be without symptoms similar to high blood pressure. So I do think we have an important opportunity now to use the tools to our disposal to really make sure that patients at high risk are able to screen and detect high blood pressure as well as atrial fibrillation at home.
Absolutely. No, I would agree entirely with what you've highlighted. And we've also know the combination of hypertension and AF itself significantly increases the risk of a stroke. And of course, stroke can be devastating. We know that the financial impact it has and the impact on the patient can be measurable and significantly impact the patient for the rest of their life in terms of functionality and their quality of life as well. You touched on some of the new devices that are available, and there are obviously lots and lots of devices available. We know we've had hypertension monitoring, blood pressure monitoring cuffs for a long time, but increasingly now rhythm detection and pulse detection devices. What are your thoughts on some of those devices? Are you using them in your practice? Are they being seen in South Africa and Australia at the moment?
Yes, well, I think everybody is aware of, all these different types of wearables, watches and patches and name it. But I think for blood pressure monitoring, at least speaking for blood pressure, I think it's important to just confirm that if we cannot really rely on these devices as yet because they're not properly validated. Validation is truly everything. Even many of the cuff-based devices out there are not validated for accuracy. So I would definitely say when it comes to wearables, I think the future is there, but we're not there yet. And therefore, I always strongly recommend relying on validated devices for both blood pressure and atrial fibrillation. And that is what patients can use these days at home, right? Is that what you've also been using?
No, absolutely. I would echo your thoughts on that. And I think validation is absolutely critical. Reliability of measurements is also important. And particularly when it comes to blood pressure monitoring, it's important that patients are aware that readings can be aberrant. They take averages, they take them at different times in relaxed settings, wait several minutes before they repeat them again. So I think that absolutely echo your messages. In terms of rhythm monitoring, we've seen an explosion in the last 5 years or so. And, from wearables to handheld devices, we now have 6-channel recording as well, previously only 1-channel recording. And all of these things, I think, have really helped in detecting atrial fibrillation, particularly. The key thing, I think, is ensuring that patients once again use devices that are validated. Very, very important that they're accurate, and also when they do take recordings, they often do need some help with interpretation.
Yes.
There are some algorithms that are validated that will tell you that you're in normal rhythm or you're in atrial fibrillation or something else. And I think it's important that where there is this doubt, where there is this something else, patients are able to make contact with a healthcare professional, with their family doctor or a cardiologist or whoever it might be. They can get help to have a look at the tracing and if need be take repeat tracings. And that is important.
I think if I can just get in there, I think it's important that the benefit of this home monitoring is really highlighted, because when you just check for atrial fibrillation once or for blood pressure once, there's a good chance of false positives or false negatives. And the benefit of home screening on a longer term basis is that you can obviously detect when you do it many multiple times, maybe 3 or 4 times during a week. Is much better than once in a clinical practice. So it's a major benefit over the long term, especially I think when we target the higher risk patient who has a high likelihood of having atrial fibrillation and stroke. And I think you would agree with me, that's really a matter of older age.
Absolutely. Age, of course, is a big factor. The European Heart Rhythm Association have provided some guidelines on these digital technologies that are available. Age is a big factor, so if you're over 65, if you're over 75, then it becomes even more important. And if you've had a prior stroke, then that's also considered a very important. We know that immediately you're under a higher risk group. So Alta, another important area I think that a lot of our viewers will be wondering about is diagnosing and management of hypertension in ladies and females, both in terms of detection and treatment. Do you have any comments about that?
Yes, I think, for many years there's been this understanding that women are typically less likely to have hypertension and heart disease, and that is because before menopause, blood pressure is often much lower in women. I think, therefore, both from the clinician side as well as from the patient side, it's been not seen as a high priority as it is typically been for men. But of course, after menopause, the dials change, and women are at much higher risk than men, and that's why we see after the ages of 50, 60 that blood pressure in women excels and actually overtakes the blood pressures of men. But still, I think it's under-detected and under-managed because of the long-term understanding that it's not such a big risk in women. And I think an important aspect as well is there's been more and more evidence showing that at lower blood pressures, women actually have higher risk for cardiovascular outcomes than men. It's not really taken in guidelines as yet. I think evidence is still accumulating, but it just reinforces that we shouldn't ignore high blood pressure in women. It's not just going to go away. It's not at lower risk, and we should measure, even though women may be younger.
Yeah, then I absolutely would agree with everything you've said there. So I think it's all about increasing education, increasing awareness, and making sure that actually we're equally effective, whether you're male or female, that we're careful in terms of detecting and treating appropriately.
Yes, absolutely.
There are some additional risk factors that increasingly we learn about. We've always known about hypertension, of course, and diabetes, but CKD, COPD, and of course, importantly, sleep apnea is increasingly being recognized as well. And I think taking all of those things into account, I think these home monitoring devices are going to be absolutely vital. We do need to ensure the support structure is in place, but I agree with you. I think over the next 5 to 10 years, that's where things are going, because that's where we're going to pick these things up. People don't have 12-lead ECG monitors at home. They can't do a 12-lead ECG. However, they can relatively easily do single-channel, 6-channel recordings.
Yes, and they're accurate.
And they're absolutely. And if they're able to get the help they need, we can have early detection and then hopefully earlier intervention and preventing the devastating, the problems of stroke and all the other negative outcomes associated with AF. We performed a small study in Coventry where we actually looked at the usability of these 2-in-1 devices. So Omron have the complete device, which is a 2-in-1 device, and overall the feedback from our patients and public volunteers who participated was very favorable. They felt that it seemed to empower them, so they had the control to take recordings, to measure their blood pressure, and then go to their physician with the data there. So that was a big plus, I think. But the key thing also was that there needs to be the support in place, because if people are taking recordings and there's doubt, they will be panicked. Is this normal, abnormal? If they have nowhere to turn to, that can be a problem.
Yeah, absolutely. And so I assume the app associated with it helps the patient to understand the results better and to take that then to the physician?
Absolutely. So the app can certainly help and can help. But sometimes recordings, again, this is where education is important, to take a good quality tracing, what you needed to do that. But the app and of course AI we know is emerging as well, and I'm sure those technologies will also help as well in detection. So it's an exciting time.
It is an exciting time, but I think here the key message, as you've mentioned, is making sure that the devices being used are validated for accuracy.
Correct.
And not to really get distracted by the thousands of devices that's emerging without a track record.
Yeah, absolutely. I think validation is critical, and ensuring that the results you're getting are accurate, validated, tested, absolutely critical. I would entirely agree.
Bye. Thank you.
So in conclusion, I think I think it's an exciting time. I think we are at a stage where we're at the cusp of this technology, this revolution that will hopefully empower our patients. And it may mean more work for us, but actually I think it'll be a good way of detecting, preventing, and treating these dangerous conditions that often are completely undetected. As you mentioned, with atrial fibrillation, it can be asymptomatic. Hypertension very often is asymptomatic.
Absolutely.
So detection is the key, and then intervening in the most appropriate way.
And I think the important message is as well, if it's early detected, it can be effectively treated, and when treated, it reduces the likelihood of future strokes and heart attacks. So prevention is key. Yeah.
Absolutely, entirely agree.
Thank you very much.
Thank you very much.